Start with central part of the patella, 1 centimeter laterally and 2 centimeters near the upper pole of the patella. At this point you have good access, close to distal to the tendon. A longitudinal access of 2 to 3 centimeters is made where the pre-tendon fat is evident. Here part of this fat can be removed, as visualization is more interesting. Thale is changed as we consider the skin to be a contaminated region and thale should be changed to an internal L. At this moment, the gauze is placed dissecting the anterior part of the tendon even deeper and closer. The tendon conversion point is identified and the medial and lateral delimitation is made. At this point it is interesting to leave a margin of 10 mm detail so as not to weigh your hand too much on thale so as not to deepen the plane too much, as the right-left tendon is a very superficial tendon. Dissection on the lateral part begins. You must dissect from lateral to medial. At this point dissect the plane between the rectum and the vast with Kelly from lateral to medial in order to delimit the tendon. At this point, you should dissect the most distal part of the quadriceps tendon, where the left rectus tendon joins the other blades of the quadriceps tendon. Be careful on this part not to invade the joint capsule. An important tip is always to pull the tissue a lot with the rat tooth tweezers so that an easier plan is created and you have clear dissection between the rectum and the blood vessel. At this time, we do the tendon suture from 4 to 6 centimeters. After suturing comes a very important one step, which is to identify the lateral and middle fins of the left rectum. It is interesting to always clean the upper front part of the tendon, and at this moment, you are able to identify exactly the point to release it. Here you dissect the lower part of the tendon plus posterior part of it. Identifies the lateral fin. Interesting to always enter with the scissors facing the lateral part so you don't amputate the graft. Now invert the scissors to the medial part and release also the medial part of the tendon of the rectus femoris. At this time, place your stripper and bend the knee between 30 and 40 degrees. As it is a very robust tendon, care for the stripper does not swallow and thereby amputate the graft. Make gentle movements with small rotations. If the extraction is successful, the stripper will go to the proximal part of the tendon, going practically all the way into the... Finally, you can do a 90 to 180 degree spin of the stripper.